What is up, all of you awesome and amazing people on YouTube? The old Coot here, coming at you with another exciting video talking about vitamin K2 MK7. This is all the latest craze in the health, fitness, overall well-being of the human body. Basically, I like Nutricost. They're a good brand. I feel like you get the best quality, the best value, and pretty much the lowest prices. I think a lot of other companies wish they could be as good as Nutricost. Anyways, I've talked to my doctor and I've started taking this. The short, sweet answer of what it does and how it works is basically it removes the calcium from your soft tissue and it puts it back into your bones. So if you have the kind of situation where you have low bone density, maybe you're getting some fractures, you're getting up there in age, or even for the young at heart, you're trying to prevent a heart attack or at least, reduce the symptoms or the signs or the causation of arterial plaque. Maybe you have high blood pressure. Talk to your doctor. That's the first thing I would do, is talk to your doctor, a physician, a medical professional. Ask them if this might be the solution for you or something that you should be taking, because everybody's different and everybody's situation is different. I know that in my specific case, I'm taking this more for prevention than anything else. But it's more of like to reduce arterial plaque, right? Building up of calcium in the arteries. The way that whole process works, just to put it simply, is usually there's some kind of inflammation. Like inflammation, I think, is the root cause of a lot of medical problems that are going on right now, just in general. But that inflammation causes a repairing effect. And what happens is calcium goes into the arteries to repair that inflammation or to fix that inflammation. And what vitamin K2 does is it prevents the calcium from building up in the arteries. That's the shortest, sweetest explanation I could possibly give you. And at the same time, what it does is working with calcium and D3, right? Those other two vitamins. Basically, K2 helps the calcium to go back into the bones where it belongs. So that's the shortest, sweetest explanation. Normally, if you're eating a good, quote unquote, European diet of like hard cheeses and meats, a lot of the things that most doctors say contribute to the heart issues, ironically, if you're eating that kind of stuff, you're probably getting plenty of K2 as it is. In some cases, though, like in my specific case, I find that just talking to my doctor and taking the supplement is just extra insurance. So if you just want to get a quick look at the product here, I'll turn this around so you can see the supplemental facts and the nutritional information. Yes, it does have sunflower seed oil. I guess that's like the medium or the transportation method that this particular company is using to get that K2 into your system. But it's, in my opinion, it's better than soybean oil. So at least you get sunflower seed oil. It's a little bit better. So there's your soft gel material, right? You got gelatin, glycerin, and then the caramel color I could do away with. And then there is some purified water. Let me open this up real quick so you can take a look at what's in here. But basically, see as I get the cap off, pour some out. Basically what you're getting there is a whole bunch of soft gels. And they look black on the camera, but in person, it's kind of like a reddish, purplish color, like a deep purple color. But that's basically what they look like. They're very, very tiny, as you can see, about the size of my fingernail. And that's basically what they look like. So 1 per day is the recommended, dosage that they want you to take. My doctor agrees with that. 100 micrograms. So it's not even a gram. It's like 1/10 of a gram of what you're getting in here is that vitamin K2. And also, I believe there was a study recently published where they said that for every 10 micrograms or something similar, or for like 60 micrograms, I can't remember the exact numbers, you do get X amount of percentage of reduction of arterial plaque. So that was one study. Like I said, your best bet is really to talk to your doctor, see what your doctor thinks. because your doctor knows your situation better than anyone on YouTube could ever tell you. So that's my advice to you. Remember, this information is purely here for entertainment value. I'm just sharing my story. If you gain some knowledge from that, great. But I'm in no way, shape, or form giving any kind of medical advice or claiming to be an expert in any way. I'm just saying, talk to your doctor. See what your doctor recommends for you and for your specific situation. What I can say in my situation is that I'm hoping this will prevent high blood pressure, right? Because think about it. If your artery walls are like this and you've got calcium built up in there, you're going to have an increase in blood pressure. So I'm trying to prevent high blood pressure by keeping my arteries and veins running smooth, right? There's no deposits in there to restrict the blood flow or to cause a backup, which then would cause the high blood pressure. Does that bro science make sense? Yes, I'm calling out the bro science. Anyways, if you do like what you're seeing, hopefully you will do your own research. Obviously, talk to your doctor and all that good stuff. Hit that like button if you like what you're seeing, that thumbs up. Give me a subscription. Go ahead and hit the subscribe button and check out the links in the description for more products like this if you want to go ahead and check that out, and also a link to this product as well. And I will catch you all on the next exciting video review.